This is the award-winning Lee Pitts Live.
Brought to you by the North Law Firm. For car accidents and negligent security cases, call Joe at 239-337-1191. And by Lee Health.
Southwest Florida, welcome to another edition of Lee Pitts Live. And yes, we are here at the Children's Hospital, Dallas Sano's, Southwest Florida's finest children's hospital. So happy for the accommodations. We have a very interesting show for you here on Lee Pitts Live. Get a chance to talk to Dr. Beal. He's the statewide HIV medical director for the Florida Department of Health. We'll also get a chance to talk to Harry Marius, the Human Services Program Analyst for the Florida Department of Health. We'll also get to talk to the tax lady. She's here, Victoria Rumming. And Girl Talk will be here with an interesting guest who owns a bakery in Naples. All that's happening on Lee Pitts Live. We'll be right back. Welcome back to Southwest Florida. We're so happy to have some experts here to keep us educationally healthy as it relates to HIV and AIDS. Welcome to the show.
Thank you.
Good to get both of you here. Start off right now with you, Dr. Beal. I said HIV and AIDS. People usually say HIV and AIDS. Is that still common lingo, or is it more just HIV?
It's still common lingo, but it really is more HIV today.
Mm-hmm. Because?
Well, because we are doing a much better job preventing AIDS, especially with our newer, better medications, better tolerated, more potent, and more durable.
Mm-hmm. Harry, what does HIV look like in the area of, in your district, which would be Charlotte, Lee, Collier, DeSoto, Glades, Henry, Lee, Sarasota counties?
Well, Lee, if you take a look at the 2016 data referring to surveillance in terms of HIV, you would see one in every time you look at 308 adults, one is living with HIV.
1 out of 308?
1 out of 308 adults. Mm-hmm. So if we break that data down in terms of demographic, talking about race and ethnicity, you would see every 476 white, one is known to be living with HIV. Moving forward, 343 Hispanics, 1 out of 243 is living with HIV. Last but not least, 1 in every 57 black is living with HIV. So it's also important to mention that there is an increase.
But that's a high percentage, though. Yes, 1 in every 57 compared to what you talked about.
Yes, indeed. And you also look at population as well. There is an increase of 4.3% in terms of newly diagnosed in our 16 report.
Now, the particular groups that are highly impacted, for all practical purposes, you just mentioned that the black community is the most highly impacted, right?
Yes.
Reason?
If we take a look at health in itself, there are components that we have to look into research properly to understand why. We're talking about socioeconomic, which is basically heavily impacting the linkage to care services. We also talk about access to services. Mm-hmm. And that we mentioned transportation, which is an issue, and stigma nonetheless is the highest wall in this field. So stigma makes it difficult for a person living with HIV to access services. Mm-hmm. And your next question might be, what do we think? What are we doing to change that?
Right, that is my next question, going over
to Dr. Beal. More education and more education.
Yeah, but I want to stay with you for 1 second, is the stigma. In my world, just as a layman, a conscientious observer, it seems that it has gotten better since when I first started hearing about HIV and AIDS back in the 80s or what have you. It seems like it's not as big of a, people don't want to talk about it as it used to be.
You're right on point, mm-hmm. but more still needs to be done.
Okay, all right. Now, let's talk about some things that are being done. You're the statewide director, so we're just fortunate to have a person of your stature here in terms of the transmission and the reduction in education around that.
Thank you. The Surgeon General, Dr. Phillip, and our leadership at the Florida Department of Health have implemented about a year and a half ago a 4-key component plan to try to reduce new HIV infections, to eliminate them completely, and then to also reduce our HIV-related deaths. The 4 key components are, the first one, routine HIV testing in all medical centers, along with STD, sexually transmitted infection testing in all of our healthcare centers as a routine of care, along with our continued outreach programs, which take care of testing for communities in a community setting. The second component is our test and treat program and retaining people in care. Our third component is outreach and messaging so that we can increase HIV awareness in our communities through engaging the communities and better messaging into those communities. And then our fourth component is adequate representation in our communities of facilities that are actively doing PrEP, pre-exposure prophylaxis, and NPEP, non-occupational post-exposure prophylaxis.
And since you've implemented those 4 steps, and one of them, of course, is outreach, which you're doing right now, millions of people listening to you, don't get nervous. In your fair assessment, how is that going?
We have a lot of work to do. The implementation of the program is in its infancy, so we don't really anticipate being able to see a decrease in new HIV infections until we're 2.5 years into our program. Hopefully, in the next year, we'll start seeing that. These programs aren't yet everywhere in the communities where we need to be. We're still working on making certain they are all fairly represented in every community in the state of Florida.
Now, when I see the word analyst on your name, seems like you analyzing a lot of stuff. You're sitting in there with the glasses on and the algorithms and what are some trends? What is that trend that's standing out to you right now?
Thinking about providing prevention, you've got to understand the data. Where is it moving to? What's the age bracket that's most affected? For instance, if you look into the age categories of 20 to 29, 50 and plus, HIV has heavily impacted these groups. So our efforts go out to provide more services, more education in these age categories. So that's what you would call an in-depth analysis.
I see. Dr. Beal, I want to get back to you on something you said in your first answer was about the normal patient services. I might be using the normal, different, not the, it seemed like it was a routine where people would get tested. You saying that has been implemented. What, in the past, it wasn't a part of the normal physical exam or something like that?
Well, that's a very fair statement. In the past, we had barriers to making it simple and easy. So first of all, the CDC in 2006 made the recommendation based upon scientific data that every American, every person needs to be tested age 13 to 65. Whether you have any risk for HIV or not, everyone should at least be tested once. And the goal behind that testing is to make certain that we identify people who don't know they're infected and don't know then that they may be transmitting their infection. So we eliminated in the state of Florida the need for an informed consent. Informed consent is no longer our way of doing testing. Our motto is an opt-out approach. So I would expect and hope you go to the doctor and you have your physical examination and your physician says to you, as a part of your routine care, we're going to be doing blood work to evaluate your health, and that's going to include an HIV test. At that time, you have an opportunity to opt out of the test, and if you do, then physicians are required to write that in their medical record, but otherwise no paperwork, no informed consent in any medical setting in the state of Florida. It's gone. We eliminated it.
That's huge progress.
That is huge progress.
The I would put that, would that still fall in the preventive category? But there are some other preventive measures, but that is one of them, early detection, learning early.
Definitely an important
Go ahead and expound on some other preventive practices you?
Probably our strongest and our most innovative in the state is the Test and Treat program. And the Test and Treat program is you find out you're HIV infected today and you are invited to come immediately to a clinical center, same day, bringing you into the office, talking with you about your infection, talking with you about the importance of the medications. The medications are actually one of our prevention strategies. If we put people onto medicine as soon as possible, and it does some important things. First, it improves their survivability. They will live longer. Second, it decreases the chances of complications of HIV, so they'll live longer. And the third is it reduces the infection to a limit that we call below the limit of detection of our test. And when your HIV viral load is that low, we know that you cannot transmit this infection, so treatment is prevention.
So the way you're describing it now is also more considered a chronic disease as opposed to, like when we used to hear somebody had HIV, we expect them to be dead in a couple of years, right?
Right. No, today a newly diagnosed young person aged 20 with HIV infection started on the new medicines that we have today should expect to live within a few years of a full normal life expectancy.
Back over to you, Harry. Technology has advanced substantially now. What I know that's your question, but you may can handle it. What is the testing process? What happens at testing?
Well, testing is the most and the best tool that we use to prevent HIV from passing one person to another. And as Dr. Beal mentioned, if we're able to help you find out your status sooner, we're able to also provide prevention throughout the community. So basically,
Blood pool?
we do different types. We could use an OAssure, that's technically to do a swab,
really? Okay.
to do a swab to determine whether or not we found antibody, HIV antibody. And once we find that antibody, we do further testing. We collect blood. That could be basically a finger prick. And we collect blood to do more analysis, basically, to find out, well, we do a CBC knowing how you're doing. What's your CD4, what's your viral load. So this is the process. But if you're talking about the testing process as it goes, pre and post-test counseling is very important in testing. This is when the person is aware of what is HIV and how to prevent the transmission from one person to another.
Where can people go to get tested?
Testing is available throughout the cities in our state, and there are confidential, convenient, and convenient as well. So wherever you go in our states, if you live here, going to Miami, going to Port St. Lucie, wherever, you will find a site that will be available to do testing. And at the same realm, the PrEP that Dr. Beal mentioned also is available in some of these areas.
Okay, and we have your website coming on the screen from time to time. We encourage people to go to the Florida Department of Health website. The Magic Johnson, walking around, seems healthy. We know he's wealthy. We figure, and I'm sure you heard this a million times, it's a good time to say it on television, talk about it. People say that he's getting some different types of medications, maybe. That's why he's so, and we've heard rumors that he was cured. Unpack that for me.
I have no personal knowledge. I don't know that I can answer that accurately, but I'd be surprised if he was taking anything different than the routine standard medications that we have today. They are so good. And he's a great example of a patient who's compliant, a patient who actually keeps their appointments and does their routine laboratory studies. We see patients living with HIV now once every 6 months. That's all the more frequent we need to be able to maintain their health. And he's a living example of taking care of himself and doing the things he needs to do and taking his medicine to be healthy.
But he is not cured.
Not
There
to my
is no
knowledge.
cure for HIV.
There is none.
As we speak.
Okay, we'll stay with that. Technology, where are we from the early days when we started seeing HIV and AIDS cases to now? Where are we in terms of advancement in technology? I understand now you might can just take one pill a day.
Most of our medications.
And it used to be a cocktail or something? Go ahead, Doc.
I mean, it used to be a ton of medicines taken very frequently. There was a time when we were dosing people every 4 hours at the beginning. We're down now to one pill once a day. And many of our medicines are now co-formulated. It still takes 3 highly active HIV medicines to maintain long-term control, and many of them now are packaged in 1 pill, which makes it so much more convenient for the patients, and they're much better tolerated.
See, you guys is like, this guy's been reading up. He knows a little something.
Yeah.
I understand too, Harry, you maybe can speak to this, keep you both talking, is that you can actually find out your results a lot faster now than you used to in the past.
Absolutely.
There are
yes.
some tests you can find out like immediately.
The rapid HIV testing, within 20 minutes or so, you can get your result back.
Is that over the counter? Is
They
that at a
do
pharmacy?
have some
You
tests
guys
over
trust
the
that
counter.
stuff?
You bet.
You good with it, Doc?
You bet.
Okay.
CDC,
Go ahead, go ahead.
CDC approved.
Okay. That's called the what?
The rapid
Just go in.
HIV testing.
Okay, and you put a little strip on or something like that?
Yes,
Like a
and
pregnancy test or something like that?
Similar to that,
Mhm.
and again, we stress a lot on the pre and post test counseling, because what happens after a person receives positive result,
Right.
the demeanor's changed. So if you didn't do a
Depression
good
and all
job
of them.
in terms of letting the person know the options, the services available in the area, and the old myth used to be if you're HIV positive, you will be dead soon. So we've got to clean that.
But I know you in the trenches, both of you in the trenches, but to me, it seems like that is getting better. Maybe it's because I'm constantly trying to educate people in situations like this, but the fact that Magic Johnson being an example that you can live a longer lifestyle, healthy, longer if you get tested early, get on medication early. But from what I'm hearing from you guys, you feel like the message is not out there. Go. Is it better? More people are aware of that? Because I'm even aware of it, that you can live long life.
Yeah. Well, and I'm very grateful that you're talking about it, because we need people like you to get this message out.
Okay.
We have too many people who still are not in care in the state of Florida. We have to identify the people who don't know they're infected. You have to remember, you become HIV infected, you actually are going to not develop signs and symptoms of your infection. You will think that you've had a really severe cold, cough, or a flu, a really severe flu-like illness. 60% of the time patients have that, and then you don't feel anything for 8.5, 15 years, no signs or symptoms. I can't even tell by doing your routine blood work. I have to have an HIV test to know if you've been infected.
Okay, let's go basic Sesame Street, Harry. How does one contract HIV?
HIV is transmitted through sexual contact that we know primarily. And that happens of one person who is HIV positive to another person who is not HIV positive. I can add to that, if the person is in care and taking medication, there is a reduction. We would say less likely to pass HIV on to the other person if this person is taking medication, is virally suppressed. Now, we also have evidence of mother could pass HIV through their babies. So basically, we also have a very slight percentage of IV drug users.
That's what I
very
was waiting
small,
you to say
but
that.
it's part of the equation as well. It is not that big, it is part of it. So mostly, we see more into sexual contact.
Okay, let's go to blood. I hear people say you can get it through blood. You can't get it through a handshake or kissing or anything like that and sweat,
That's
right?
correct. That's
Go ahead
correct.
and demystify, knock down a few of the myths.
Oh, where do I start? Man, you know, the only way that you can become infected by exposure to blood is if you don't have intact surfaces. This intact skin surface that God gave us is a tremendous barrier. You can clean up blood. We prefer that we take precautions with all of our blood. We've changed all of our practices. But the only way you can become HIV infected is either by sharing blood, injecting drug use behaviors, or through sexual contact, having sex without condoms.
Okay.
That's it.
That's it.
That's
Okay, that's short and sweet. Well, gentlemen.
Mention the mother to child, of course.
Right.
Thank you.
Well, it's been a pleasure having you both on the show. I'm looking forward to getting you back again. Don't be strangers. This is vital information, and you guys have really been impressive with your knowledge, and keep up the good work with the Florida Department of Health.
Thanks for
Same to
having
you.
us.
Thank
Let me
you.
bump you out. Stay right there. As the saying goes on this particular show, for those who say it can't be done, they're usually interrupted by those who are doing it. When we come back, Girl Talk with Tashika Perry, and then we'll talk to the tax lady. Victoria Rummin is here, all on Lee Pitts Live. Stay with us.